Stay alert! 5 surprising signs your liver is suffering. Did you know that liver disease affects over 30 million Americans? That's almost 10% of the population struggling with a vital organ that we often take for granted. The liver, your body's silent guardian, works tirelessly to filter toxins, aid digestion, and regulate metabolism. But when it's in distress, it may not always shout for help. Sometimes it whispers. In today's fast-paced world, we're often caught up in the daily grind, seldom stopping to consider the toll our lifestyle can take on our bodies, particularly on organs like the liver. The liver is a powerhouse of an organ, crucial for digesting food, storing energy, and removing toxins. However, its resilience has its limits, and the signs of trouble might not always be as clear or as immediate as we might expect. The reality is, liver health is pivotal to our overall well-being, playing a role in everything from our energy levels to our complexion. But beyond these broad strokes, the liver's well-being affects our quality of life in profound ways that can go unnoticed until serious issues arise. It's an organ that forgives but doesn't forget. Years of subtle neglect can suddenly manifest as critical health issues, disrupting lives and causing widespread distress. In our video today, we'll delve into some unusual and often overlooked signs that might indicate your liver is struggling. Recognizing these signs early can make a significant difference in treatment outcomes and overall health. We'll not only uncover these signs, but also explore practical solutions to address them, emphasizing that timely action can reverse or manage the damage and restore health. This topic isn't just about health, it's about maintaining the quality of life and ensuring that you can enjoy life to its fullest without being held back by underlying health issues. So let's pay attention to what our body is trying to tell us, take proactive steps towards health, and respect the organ that plays a pivotal role in keeping us active and alive. Number 1, yellowing of the skin and eyes, jaundice. Jaundice, a term many have heard but few fully understand, is often one of the first clear indicators of liver distress. It manifests visibly as a yellowing of the skin and the whites of the eyes. This discoloration is due to bilirubin, a yellow pigment formed from the breakdown of red blood cells. Under normal circumstances, the liver processes bilirubin, which is then excreted through bile. However, when the liver is damaged or failing, this process is disrupted. As bilirubin builds up in the bloodstream, it begins to deposit in the skin and mucous membranes, leading to the characteristic yellow tint of jaundice. This symptom is not just a superficial concern, it is a potent sign that the liver is not performing its critical functions. It can be associated with various conditions, all warranting concerns such as hepatitis, cirrhosis, or liver cancer. Understanding this sign is crucial as it is not only an indicator of current liver impairment, but also a warning of potential severe complications if left unchecked. Upon noticing any yellowing of the skin or eyes, it is imperative to consult a healthcare provider immediately. This symptom requires urgent medical evaluation to determine the underlying cause and to prevent potential life-threatening complications. The treatments for jaundice depend significantly on the underlying condition affecting the liver. In some cases, medications may be prescribed to treat liver infections or to reduce inflammation. For others, lifestyle changes such as adjusting diet, reducing alcohol intake, and managing cholesterol can support liver health and reduce symptoms. In more severe scenarios, surgical options might be necessary. These can range from procedures to remove blockages in the bile duct to more invasive interventions like a liver transplant, which may be considered in cases where the liver damage is irreversible. The approach is tailored to the individual's specific medical condition, overall health, and the progression of liver disease. Addressing jaundice promptly is crucial not only to alleviate this particular symptom, but also to improve overall liver function and health outcomes. Engaging with healthcare professionals allows for a comprehensive management plan, ensuring that each patient receives the most effective and appropriate care for their situation. Number 2, itchy skin. Itchy skin, medically known as pruritus, can be a less commonly recognized sign of liver dysfunction. When the liver is unable to effectively process and eliminate bile salts, a natural product of digestion, these salts can accumulate in the bloodstream and eventually deposit in the skin. This accumulation triggers irritation and a persistent itching sensation that is not relieved by scratching. The discomfort can be widespread or localized, often worsening at night or in warm conditions. Unlike typical skin irritations, the itchiness related to liver problems does not usually come with visible rashes, making it particularly perplexing for those experiencing it. This kind of itching specifically suggests that the liver is not just sluggish but significantly impaired in its ability to detoxify the body. Common liver conditions associated with itchy skin include biliary cirrhosis and chronic hepatitis. Recognizing and addressing this symptom early can be vital in preventing further liver damage and improving quality of life. Managing itchy skin caused by liver dysfunction involves a two-pronged approach: alleviating the symptom and treating the underlying liver condition. Over-the-counter moisturizers and medicated creams can provide temporary relief. For instance, lotions that contain menthol or calamine can soothe the skin and reduce irritation. Antihistamines may also be helpful in managing the itch, though they do not address the root cause. However, these measures are merely symptomatic treatments and do not cure the underlying issue. To effectively tackle the problem, medical intervention is necessary. A healthcare provider may conduct tests to diagnose the specific liver condition causing the symptoms, and prescribe medications aimed at improving liver function or managing the specific liver disease. In some cases, changes in diet and lifestyle, like reducing fat intake and avoiding alcohol, can significantly support liver health and reduce the accumulation of bile salts. For persistent cases, more specialized treatments under medical supervision might be necessary, such as therapies to bind bile acids in the gut or phototherapy, which uses ultraviolet light to ease severe itching. Engaging with healthcare professionals for a thorough assessment and tailored treatment plan is crucial for those experiencing itchy skin linked to liver problems, ensuring they receive the most effective care based on their specific health needs. Number 3, bruising and bleeding easily. One of the more alarming signs that can indicate liver distress is an increased tendency to bruise and bleed easily. This occurs because the liver, when healthy, is responsible for producing several of the proteins necessary for blood clotting. If the liver is damaged, its ability to synthesize these vital clotting factors diminishes, leading to a deficiency. Consequently, even minor injuries can result in excessive bleeding, and bruises can appear with little to no apparent cause. This symptom is particularly concerning because it not only affects the skin's appearance but also points to potential internal bleeding risks, which can be far more serious. Common liver conditions that may lead to impaired clotting include cirrhosis and hepatitis. Early recognition of this symptom is crucial for preventing potentially life-threatening complications and managing the underlying liver disease effectively. Addressing the symptom of easy bruising and bleeding starts with dietary adjustments. Consuming foods rich in vitamin K, which is essential for blood clotting, can be beneficial. Leafy greens, broccoli, and Brussels sprouts are excellent sources of vitamin K. Additionally, your healthcare provider might recommend supplements if dietary intake isn't sufficient or if absorption is compromised due to liver damage. However, while nutritional support is important, it is typically not enough on its own. Medical evaluation and intervention are critical to manage the underlying liver condition causing the clotting issues. Depending on the severity and cause of the liver damage, treatment options can vary significantly. They might include medications to improve liver function, treatments specific to liver disease such as antivirals for hepatitis, or more invasive procedures if necessary. For individuals experiencing significant bleeding issues, medical professionals may also prescribe clotting factor concentrates or other therapies to directly address the clotting deficiencies. Regular monitoring and tests will likely be recommended to assess liver function and the effectiveness of the treatment plan. While dietary adjustments and supplements can support overall health and improve symptoms, they should be part of a broader, comprehensive approach guided by healthcare professionals. This ensures not only the management of symptoms like bruising and bleeding, but also addresses the root cause related to liver health. Number 4, unusual body odor. Unusual body odor can be an unexpected indicator of liver malfunction. Typically, the liver helps to remove toxins from the body, but when it's impaired, these toxins can accumulate and affect the body's metabolism, including how it breaks down and utilizes substances. This buildup can alter the chemical composition of sweat, resulting in a distinct and often unpleasant body odor. This type of body odor is different from that caused by external factors like diet or personal hygiene. It has a more chemical or musty scent and can persist despite regular washing. The presence of an unusual body odor in the context of liver dysfunction is particularly concerning because it suggests a significant accumulation of toxins that the liver is no longer able to process effectively. This symptom could be associated with advanced liver conditions such as cirrhosis or acute liver failure, where the liver's capacity to function properly is greatly diminished. Addressing unusual body odor when it's linked to liver dysfunction involves more than just improving personal hygiene. While regular washing and the use of deodorants can help mask the odor, these steps do not address the underlying cause. It is essential to consult with a healthcare provider for a comprehensive assessment of liver function. If this symptom is observed, A healthcare professional can conduct tests to evaluate liver health, including blood tests to check liver enzyme levels and other indicators of liver function. Based on the results, they might recommend changes in diet and lifestyle to help reduce the toxin load on the liver, or prescribe medications to improve liver function or treat the specific underlying liver condition. In cases where the liver disease is advanced, more intensive treatments, such as hospitalization, might be necessary to manage the symptoms and prevent further complications. Consulting a healthcare provider ensures that the symptom is appropriately diagnosed and managed, and it also helps in monitoring liver health and adjusting treatment plans as necessary. Ultimately, while improved hygiene practices can offer temporary relief from the symptom, addressing unusual body odor effectively requires treating the liver dysfunction at its source. This approach not only helps manage the symptom more effectively but also contributes to overall health and well-being. Number 5. Cognitive changes. Cognitive changes associated with liver dysfunction are often referred to as hepatic encephalopathy. This condition occurs when the liver, compromised by disease, fails to adequately remove toxins from the blood. These toxins, particularly ammonia, accumulate and can cross the blood-brain barrier, adversely affecting brain function. Symptoms can range from subtle changes such as mild confusion or forgetfulness to more severe impairments like altered personality disorientation and, in advanced cases, coma. Hepatic encephalopathy is a serious indication that the liver is not performing its critical detoxification role. It's not only a sign of severe liver impairment but also a medical emergency that can have profound implications for a person's quality of life and ability to perform daily tasks. This condition underscores the liver's pivotal role in overall health, particularly in its interaction with the brain and nervous system. Given the severity of hepatic encephalopathy, it requires immediate medical attention. The primary goal of treatment is to reduce the levels of toxins in the bloodstream, particularly ammonia. This is often achieved through medications such as lactulose, which helps to decrease ammonia production and absorption in the intestines, and rifaximin, an antibiotic that reduces ammonia-producing gut bacteria. Dietary changes also play a crucial role in managing hepatic encephalopathy. Reducing protein intake can help decrease the production of ammonia from digestion, although this must be carefully balanced with nutritional needs. A dietitian might be involved to ensure that the diet is safe and adequate, given the individual's health status and liver condition. In addition to medications and diet, managing potential triggers such as infections, gastrointestinal bleeding, and electrolyte imbalances is vital. Regular monitoring and adjustments in treatment may be necessary, as the condition can fluctuate and may worsen with additional liver damage or other health issues. This condition underscores the critical nature of comprehensive care in managing advanced liver disease. Engaging with a team of healthcare providers, including hepatologists, dietitians, and possibly neurologists, ensures that the patient receives holistic care addressing all aspects of hepatic encephalopathy. In conclusion, these signs are critical indicators that your liver, an essential organ for detoxification and metabolism, may be impaired. Early detection and treatment of liver issues are crucial, not only to resolve these symptoms, but also to maintain overall health and prevent serious complications. If you or someone you know is experiencing any of these symptoms, it's imperative to consult a healthcare professional immediately. They can provide a thorough evaluation and recommend appropriate treatment options tailored to the specific needs. If you found this information helpful, don't forget to like, comment, and subscribe for more insightful health-related content. Your engagement helps us reach more people and continue providing valuable health education. Remember, taking early action can significantly improve health outcomes, so stay informed and proactive about your health. Thank you for watching, and take care of your liver. It's one of your body's most hardworking organs.